I did want to talk for just a moment about suicide, because suicide is a very important part of any affective disorder. About 90% of the people who suffer or who commit suicide every year have had a serious mental illness. Most of those folks have had an affective disorder, depression or bipolar disorder being the top of that list. Please do not ever ignore someone who says that they are suicidal. There are lots of resources out there for them to get help. One of the things that I wanted to make sure that I talked about, and I just called these folks today to make sure that this was an active line and how it works. It's the Suicide Prevention Lifeline, and their number is 1-800-273-TALK. And they can be reached 24 hours a day, 7 days a week. So if you are feeling suicidal, or a family member or a loved one is feeling suicidal, that would be a good place to start, particularly if your family doctor or your mental health center or the person who you're receiving treatment from isn't available due to after hours or something like that. Thank you, and I think that Joyce has some questions for me, so we'll pass it over back to her.
Thanks, Michelle. I do have some questions handy. If a person has been experiencing, let's say that someone has been feeling sad, and the sadness just doesn't seem to want to go away, and they really start to wonder if they have clinical depression, what's the first thing they should do?
Well, and that depends on the kind of person that they are. There are some people who are going to automatically run to the computer. If I wonder, I Google. I'm one of those. And so there's certainly some information on the NAMI and the National Institute for Mental Health websites that one could go to. There are also a number of checklists that I found on the National Institute of Mental Health that would be available for a person to just kind of get more information about what this would look like for them if they thought that they had depression. It's really important, though, to not discount going to a doctor. If you have a general practitioner, a website's not going to give you what you need to figure out whether or not you have an actual diagnosis. So if you are really thinking that you have a diagnosis, it's going to be very, very important that you talk to a healthcare provider as soon as you can, so that you can get the help that you need as quickly as possible.
I'd like to just comment on that for a moment. Sometimes it's very difficult to know when to go to a doctor to get help. I remember when I was going through, I had something happen in my family, and it was very disturbing, and when you lose a loved one, you do get very, very sad. And after a while, you know, I started wondering, well, when is this ever going to end? And I'm fortunate enough to where I work with psychiatrists on a daily basis and therapists, and I remember going to one of the psychiatrists and I said, you know, this is just hurt. It just hurts. Do you think I need to get on medication? And the response that I got was, no, I've known you for years, and I can tell you that your particular response to this is a normal response to something that has happened to you in your life. Sometimes you just have to go through the pain and get through to the other side. But I think if it had persisted longer than it did, that I would have gone to a doctor and said, no, it's gone on too long now, and it's time for me to get on some medication. But I luckily did not have to do that, but a lot of people do have to do it.
Overall, I think that a good rule of thumb would be that if you're worried that it's gone on too long, a good place to start might be a therapist. There are lots of really competent therapists in our area, all of whom would be able to help guide a person who is worried about that. Is this a natural human response, or is this something more? They would be able to guide that person as to whether or not this was something that could be worked through in a short period of time, or if it was a normal reaction, or if it was something more.
I see. When we talk about putting someone on medication, many times you have people in the community who like to go out and drink, and sometimes people also, you know, use street drugs. And I think the big question is, what happens to someone if they drink alcohol or use street drugs while they're on these antidepressants or these medications for bipolar disorder? Can you talk about that just a minute?
Well, Joyce, I think that that's a really important question, and one that we run into very often. And a part of the reason why we run into that so often is simply that so many people who have affective disorders are using drugs and alcohol to help alleviate their symptoms. Drinking and taking drugs while utilizing these medications is not a good idea. It can be very, very dangerous. If you're a person who has maybe alcoholism or who has struggled with using street drugs, it's going to be very important for your doctor who's prescribing the medications to know that, because they're going to have to pick medicines that aren't going to be as risky or as dangerous when added to that. So that's part of that. Also, I just wanted to put in a little note that alcohol and street drugs, if you're taking medication for depression or bipolar disorder, are not going to be helpful. The reason that they're not going to be helpful is because the way that they affect your body, in many cases, is going to counteract what it is that you're trying to do with the medication. Alcohol is a depressant. There are many street drugs that are actually speed that will make your mood be different as well. So it's very important that your doctor knows that. I know that a lot of people have shame associated with their street drug use or their alcohol use, but it could save your life to let your doctor know.
Another thing that is an aside that I've heard also is that people who take medication